Chief Medical Officer here at the Australian Commission on Safety in Healthcare. Today is World Hand Hygiene Day, and it's a very important day with recognising the role of hand hygiene in infection, prevention and control, and particularly its benefits in clinical care, and what a more important time we have to recognise that within the middle of it. The theme for World Hand Hygiene Day this year is achieving hand hygiene at point of care. This theme recognises the importance of hand hygiene at all points of contact between the patient and the healthcare worker during care delivery. Hand hygiene at these points of contact is essential because it prevents the onward spread of disease to others, and also because it limits contamination of the healthcare environment. The importance of effective hand hygiene is highlighted in the Standard Precautions Manual. It is the basis of each of the standard precautions, as the correct use of personal protective equipment, respiratory hygiene and etiquette, of aseptic technique, of environmental cleaning, and of linen waste management. There's no doubt effective hand hygiene is the most fundamental infection prevention and control strategy that we can use to prevent the spread of infectious diseases. I want to now hand over to Dr. Jan Walden, Senior Advisor for the Infection Prevention and Control Program here at the Commission. Jan's going to inform us about how well we are travelling in Australia in achieving hand hygiene at the point of every patient's point of care.
Thank you, Ma'am, and happy World Hand Hygiene Day to you all. Achieving hand hygiene at the point of care is core business for the National Hand Hygiene Initiative and for all of you working out there in healthcare. The National Hand Hygiene Initiative was established by the Commission in 2008 as a multimodal approach to improving healthcare worker hand hygiene in Australia. The initiative was originally designed for implementation in acute healthcare settings. However, since its initiation, some of the programs have been taken up in other clinical environments, such as dentistry, primary care, community health, and aged care. The initiative is supported by all Australian states and territories, as well as the Australian Government Department of Health. While the Commission established the initiative, implementation is led by state and territory health authorities in the public sector, and in the private sector, private health service organisations. The initiative includes support for healthcare workers and organisations through a number of online learning education modules, support resources, and a national online data collection and reporting system for hand hygiene auditing, of which I'm sure many of you are familiar with. A key part of the National Hand Hygiene Initiative are the 3 continuous audits that run each year. These audits are essentially checks to see if healthcare workers are performing hand hygiene at the 5 critical moments of clinical care, where there is an elevated risk of cross-contamination and a heightened potential for onward disease transmission. These moments are known as the 5 moments for hand hygiene. The graphic on screen at the moment goes through each of the 5 moments. Moment 1 is about protecting the patient and ensuring that the healthcare worker does not facilitate cross-contamination between patients. Moment 2 is about minimising the risk of disease-causing microorganisms being introduced into a patient's body during an invasive procedure. Moment 3 is about protecting the healthcare worker from disease transmission after a procedure or after exposure to blood or a body fluid. Finally, moments 4 and 5 are about reducing the risk of a healthcare worker spreading microorganisms in the healthcare environment and to other patients. Organisations that participate in the national audits submit their audit data using the Commission's Hand Hygiene Compliance application, the HICAP, which is a bespoke online compliance reporting system. For those unfamiliar, this is what the HICAP looks like. There is also a HICAP mobile device interface available for real-time data collection. This has become increasingly popular as it does away from the extra data entry step required when collecting data on a paper audit form. There are over 11,000 active auditors on the HICAP system, which is really a huge workforce out there collecting audit data. These auditors undertake this task as part of their usual work duties. At the most recent audit, which concluded in March this year, Australian hand hygiene auditors collected in excess of 600,000 moments. Skill and dedication of auditors to keep their auditing capabilities up to date enables our national audits to provide a robust and informative picture about hand hygiene compliance in Australia. Auditing can be a tough task, particularly when a key part of the auditor's role is to feed back audit results to colleagues. Sometimes these can be pretty difficult conversations, but they're conversations that are so critical to changing behaviour and making clinical practice safer for patients and for other staff. This feedback makes people accountable and is the catalyst for improving infection prevention and control. So a big thank you goes out there to all those auditors. Thank you for your hard work, as it really does make a difference to improving patient safety. Across Australia, there has been an increasing number of public and private sector organisations participating in the national hand hygiene audits. In this chart, you can see that back in 2009, when the first national hand hygiene audit began, we had just 105 organisations submitting data, and they were all from the public sector. In 2011, the National Safety and Quality Health Service standards were introduced, and this triggered a big jump in audit participation across both sectors. This is because all organisations that are accredited to the National Safety and Quality Health Service standards are required to have a hand hygiene program in place that is consistent with the National Hand Hygiene Initiative. And for many organisations, this meant submitting data to the national audits. The first audit period after the release of the first edition of the standards saw 629 organisations submit data. This number grew to over 1,000 in the audit period following the release of the second edition of the standards in 2017. National audit participation peaked in 2019 with 1,124 organisations submitting data to Audit 3 that year. At the close of the most recent audit in March this year, we had 1,107 organisations participating in the audit. In recognition of the importance of hand hygiene in clinical care, the former Australian Health Ministers Advisory Council endorsed a national benchmark of 70% for hand hygiene compliance in 2012. This national benchmark was recently increased in 2017 and currently sits at 80%. Public reporting and regular review of the benchmark has enabled Australia to continually raise the bar and push for continuing improvement in hand hygiene compliance and infection prevention and control. As you can see from the dotted blue line in this chart, the national hand hygiene compliance rate has exceeded the 80% benchmark, which is in the pink dotted line. And this has occurred now for several years. This is really quite a remarkable feat and represents almost a 20% improvement in hand hygiene compliance over the last 10 years. The vast majority of Australian health services that are participating in the national audits are meeting and exceeding the national benchmark, which is shown by the dense green section above the pink line. While there are a few organisations still below the pink line, we are seeing that there are fewer and fewer of them at each audit period, and the mean compliance rate for these organisations below the line is also on the increase. Reporting of the national compliance rate is on the Commission's website, and organisation level data is also available on the My Hospitals website. Current requirements are for the national compliance rate of each of the 5 moments and for each healthcare worker type to also be reported on the My Hospitals website. The national compliance rates for each of the 5 moments are regularly over 80%. At the end of last year, 2020, the compliance rate recorded for moment 3 after blood or body fluid exposure was 93.3% and was the highest compliance rate for any of the moments. Moment 3 is particularly important for ensuring the protection of the healthcare worker and the prevention of onward disease transmission. For those moments specific to immediate patient protection, moment 1, before touching a patient, and moment 2, before a procedure, compliance was 85.4% and 91.2% respectively. Despite sustained improvements in overall hand hygiene performance since 2010, embedding effective hand hygiene across all clinical disciplines and clinical settings remains a national challenge. A recent success story, though, has been the improvement in the hand hygiene compliance of student doctors, who exceeded the current benchmark for the first time in 2020. Congratulations. This improvement is not only a testament to the efforts of these students, but also their education providers and clinical colleagues for embedding a work culture that recognises the importance of hand hygiene and infection prevention and control more broadly. We have also seen consistently high compliance rates over time from nurses, allied health professionals, and invasive technicians, all of which have met the relevant national benchmark since 2012. While still below the national benchmark, doctors and domestic staff have demonstrated continual improvements in compliance, with both groups only slightly below 80% at Audit 3 2020. Across the hospital environment, the vast majority of clinical units in Australia regularly report very high hand hygiene compliance rates. In fact, at the last audit last year, all departments besides EDs had compliance rates over 80%. While over time, EDs have continued to improve their compliance, and they did achieve 80% for the first time at Audit 2 last year. What is actually most reassuring to see in this chart, though, is that it's the high-risk units, critical care, renal units, oncology units, and transplant units that have a very high standard of hand hygiene. And it's really important in these settings because these are where some of the most vulnerable and at-risk patients are receiving care. The Commission continues to work closely with the states, territories, and the private sector to review, refine, and enhance the National Hand Hygiene Initiative to ensure that it continues to meet the contemporary needs of the Australian health system. The objective of the National Hand Hygiene Initiative remains unchanged though. It's about ensuring patient safety and better patient outcomes by promoting routine performance of hand hygiene at the point of care. If you would like any further information about the data that has been provided today, or about the National Hand Hygiene Initiative more generally, please visit our website, safetyandquality.gov.au/NHHI. Once again, I wish you happy World Hand Hygiene Day.